Hi, I'm Joseph, and I've been living with HIV for 31 years.
I'm Kerrigan, and I've been living with HIV for 13 years.
I want to spend a few minutes talking to you about how HIV affects the body.
Today, it is possible to live a long, healthy, and fulfilling life with HIV.
Important advances have been made in controlling the effects of HIV with antiretroviral medication and in preventing and treating HIV-related illnesses. With early diagnosis and treatment, a good social support system, and a knowledgeable healthcare team, a person with HIV can live the life they've always imagined for themselves. Let's start by taking a brief look at how HIV affects the immune system. This will help us understand why an early diagnosis of HIV, followed by treatment, is important for ongoing good health.
The immune system organizes a complex response to fight viruses and bacteria that enter the body from the outside world and cause infection. In the case of HIV, once the virus has entered the body and established an infection, the immune system tries to fight it off. However, in most cases, the immune system isn't able to effectively control HIV on its own.
That's because HIV targets and enters a type of cell in the immune system known as the CD4 cell, which plays an important role in directing the immune system's response against infection. When HIV enters the CD4 cell, it takes control and uses the cell to make more copies of itself. In the process, HIV destroys CD4 cells and the immune system's ability to fight infection. Once in the body, HIV usually begins to reproduce very quickly, infecting CD4 cells and other parts of the immune system, weakening it over time.
The period when HIV infection is becoming established in the body is known as a primary or acute infection.
The amount of HIV in a person's body, known as their viral load, is very high at this time. A person who has just been infected with HIV may experience brief flu-like symptoms or may have no symptoms of infection at all.
Within the first few days after infection with HIV, the virus spreads throughout the blood, organs, and other major body systems.
The immune system attempts to fight off HIV, but isn't able to.
As part of its defense, the immune system produces small proteins called antibodies against HIV. These antibodies, which are detected in most HIV tests, produce a positive test result.
The period of time in which a person first develops antibodies for HIV is called seroconversion. Ideally, people at ongoing risk for HIV get tested regularly. By doing so, they can find out they are HIV positive early in their course of infection. We know that the sooner antiretroviral medication is started after HIV infection, the better it is for the long-term health of the person with HIV.
Immediately after infection, HIV starts to weaken the immune system, even in those people who don't experience any symptoms.
With the effective and easy-to-take treatments now available, many people can limit the effects of HIV infection in their body by starting treatment early and maintaining an undetectable viral load. HIV treatment is made up of a combination of drugs that interfere with the virus's ability to make copies of itself. Today's treatments are so effective that when used correctly, they can reduce the replication of HIV in most people to levels that aren't detectable by current technology. Being undetectable doesn't mean that HIV is no longer in your body. It's still there, but at greatly reduced levels. The sooner the harmful effects of HIV on the immune system can be controlled, the healthier the immune system will stay over the long term. Early HIV testing and treatment allows people with HIV to get on with their lives while managing a chronic illness.
Some people don't get diagnosed until later in their infection. Though HIV testing and treatment are available to all Canadians, not everyone is able to take advantage of them.
Stigma, mental health issues, substance use, homelessness, and other factors may interfere with a person's ability to care for themselves. In people who aren't on treatment, HIV continues to replicate, destroying CD4 cells and damaging other parts of the immune system. This process takes place progressively over a period of years. At first, a person may feel well and be symptom-free. But over time, lab tests will show that the CD4 cells are decreasing, leaving the body without immune protection.
At this point, a person will usually develop symptoms and begin to experience various illnesses associated with HIV disease.
As HIV overwhelms the immune system, these symptoms will become more severe and ultimately life-threatening. A person with untreated HIV will eventually die from AIDS.
AIDS is the late stage of HIV infection.
It's the name for a specific set of serious illnesses that occur when a person's immune system isn't functioning. These illnesses are sometimes referred to as opportunistic infections. With timely and effective HIV treatment, it's possible for a person who has developed AIDS to recover and regain some of their immune function. Having a chronic viral infection like HIV can lead to ongoing activation of the immune system and inflammation in the body.
When a person is infected with HIV, inflammation is part of the body's effort to fight off the virus.
Taking HIV treatment can greatly reduce but not eliminate chronic inflammation. Even low levels of HIV in the body, like those seen with effective antiretroviral therapy, can cause inflammation. As a result, people with HIV are at a greater risk than others of inflammatory diseases like cardiovascular disease, particularly later in life.
Now that people with HIV can expect to live long lives, the challenge becomes to live well.
HIV treatment works as well in older adults as it does in younger people. However, some people who have been living with HIV for a long time may be taking many other drugs along with their antiretrovirals. They may also be experiencing specific health issues related to earlier treatments for HIV that were less effective. Living with HIV and taking HIV treatment has an impact on the body as it ages. People with HIV are at increased risk at a younger age for conditions like heart disease, diabetes, bone loss, cancer, and other cognitive changes.
As a result, they may face the challenge of managing multiple conditions associated with HIV and aging.
When it comes to aging well with HIV, good self-care practices like eating well, exercise, stress reduction, and harm reduction approach to substance use continue to be important for staying healthy.
Having a good relationship with a trusted doctor helps to manage HIV and other health conditions as they come up.
Because isolation and depression can affect many older people with HIV, social networks and engagement become even more important. That was a quick summary of how HIV affects the body. But the main message is that with effective treatments available today, it's possible to live well with HIV.
If you're looking for more information, visit www.catie.ca.